Lillian Posadas, a former registered nurse, began her tenure as administrator and CEO of Guam Memorial Hospital in January of 2019. As she prepares to retire at the end of this month, she says she's thankful to the governor for trusting her to take on the position, one she never took lightly. From the start, Posadas says her goals centered around people.
When I first came into this position, the three things that I was really looking at is the employee development and training, just to kind of get the employees feel comfortable in some skills to carry on their duties, whatever level that they're in. The second goal that I was kind of aiming to achieve is recruitment of, young people. Not anything to discriminate the senior people, but, those who are young, who are potential, especially in leadership roles here at the hospital, and with the caliber, critical thinking skills, communication skills, and just with that level of thinking and, talent. Succession is really what I was really thinking of, to have that line of succession for individuals who feel comfortable, who feel that they have the knowledge and the skills and the attributes and even the attitude, and to really then be the leaders and managers of this organization, because it demands a lot.
After just over a year into her leadership, the unexpected happened.
Well, I started in January 2019, and we had in 2020 the pandemic. That was really a very, very tough time. There was so much uncertainty, so much fears, and just anxieties on how we're going to deal with the individuals and how we're going to take care of them, knowing that, the condition they have is very contagious, very infectious. We didn't really have much of a capacity here, with regards to making sure that we keep them isolated with the negative air pressure. But we had tremendous support, tremendous help, not only from our local communities, from private sectors, from the governor's office, Homeland Security, from the military. So that was a very, very tough year, very challenging years, and but we pulled through. Yes, unfortunately, we lost some lives, and that was traumatic for our staff and families, but there were also others who we saved.
Beyond recovering from the pandemic and the damage sustained from Typhoon Mawar, finances have been the hospital's most persistent struggle over the decades.
The greatest challenge was really the financial, the underfunding of this hospital. It's our only government public hospital, but we continue to be underfunded. And the reimbursement rate, the insurance, the federal, like Medicare, Medicaid, the reimbursement rate is never 100%.
She says unlike a restaurant where the bill is always paid in full, sometimes accompanied by a kind tip, GMH isn't always 100% reimbursed for the services they provide.
And then when we go before the legislature every year, even though we request, like last year for fiscal year 2025, we requested, I think, about $74 million. We didn't get that. And so, that was really quite a challenge.
Recently, a $40 million appropriation was signed into law to help GMH meet immediate needs. Posadas says payments to vendors have already begun.
We want to make sure that we pay our vendors, and we're so thankful that the vendors, they understand. Also, we understand their position, that they have their employees to pay, and the goods and supplies that they bring in to Guam for us when we need it. They honor us, knowing that eventually they will get paid.
But funding isn't the only obstacle. From nurses and doctors to accountants, coders, and billers, shortages across the board continue to stretch the hospital's workforce.
The people that we have on board, they're so committed and dedicated that they do, and they get the work done as best as they can.
Walking through GMH makes it clear the hospital is showing its age. From leaky ceilings to outdated infrastructure, it's a facility that Posadas herself admits is in crisis. Even so, she points to specialty services like gastroenterology, cardiology, and pulmonology as evidence of progress, despite the building's limitations. And for those who may doubt GMH, Posadas has this message.
I'd like for them to have a better understanding, a clear understanding of what goes on here in the walls of the hospitals and the many challenges, and that, the staff give their heart and soul to provide the service that they deserve. We don't turn people away. We welcome them to come, and they're welcome to come and walk the hallways of our hospital and see how it is, and not to be afraid, not to worry, but that they will be taken care of.
As for her parting words for the team that has stood by her side,
we're all here for a purpose, and that is our Lord God's glory and purpose. And that, we are here to serve the patients that come here who need our service, who need our care. But we also are here to serve each other, to work with each other. Because when we work with each other, I tell you, it's amazing what we can accomplish together.
Looking ahead, she hopes the next administrator will bring both expertise and creativity to lead the hospital forward, as well as closer to achieving accreditation.
I hope that they will, be open-minded, and that they will continue and take the hospital to a higher level of performance of excellence and qualities, and has a young and creative and innovative mindset to say, hey, let's think out of the box. Let's try another solution, another way of doing things.
For every challenge, for every comment made, Posadas says there have been blessings along the way.
Yes, despite all the criticism, despite all the attacks, because it's not about Lillian Posadas or for Lillian Posadas, it's for the people of Guam who come here because they need to come here. That's always been my commitment, and I am just very fortunate, very blessed that the Lord has given me this opportunity.
Her last day will be on September 30th, but the work of Guam Memorial Hospital continues. For Posadas, the legacy she leaves behind is not measured in policies or budgets, but in the people who carry on the mission, and in the belief that a stronger, more resilient GMH is still possible. Nevaeh Anderson, KUAM News.